Massa Stevens is a nurse who fought in the Ebola crisis in 2014, a time when it was at its peak. She caught the virus treating a patient. Now, like many Ebola survivors, she's suffering the after effects.
I normally get the muscle pain, joint pain, and even the eye problem.
Medication is supposed to be free for her, but she often ends up having to pay for it. Her children have stepped in more to help with household work as she's not strong enough. Stephen worries about how she'll cope.
I think they will try to look out to the research that they are doing now to try to get a drug that can help the survivors.
She says if experts had known more about the disease earlier, maybe there could have been better health preparations for survivors like her. And that's part of the problem. There's still a lot unknown about the Ebola virus. Survivors are playing a key role in understanding how long the virus can linger in the body after recovery. But those fighting the disease say it was initially a huge challenge because nothing was really known about it. As more information was discovered, it became clear that having public messages like these were and still are crucial. Several international and local organizations stepped in to stop the virus from spreading. One of the challenges was getting local people to understand Ebola was real. Many thought it was a rumor.
And because of this huge denial, it was difficult for the people to abide by and respect the protocol. They did the wrong things. So the virus had a field day.
He says what worked most in all of this was providing community engagement. That meant getting authorities and local communities to understand Ebola and explain it to others.
For example, religious leaders, herbalists, people who are local leaders.
Still, he says the biggest lesson learned was that it should have all been done faster. The fact that the country has a poor health system to start also provided a setback. Providing safe and dignified burials was another key element in fighting the virus. It spread through direct contact with bodily fluids, which makes the traditional practice of washing a loved one's body after death especially dangerous, since that's the moment when the virus is most contagious. This latest death is a warning that resuming old habits too soon can be dangerous. Officials admit more needs to be done to keep people on their toes. The term Ebola-free doesn't mean Ebola is gone forever.
There is need for more engagement with our communities at all levels, whether it comes to safe practices in hygiene and sanitation measures. And that is why the social mobilization drive and communications engagement with media is still ongoing.
For now, Ebola survivor Stevens says she is trying to move forward in a positive way. Despite all the challenges, she is grateful to have survived. Nina DeVries, Al Jazeera, Freetown, Sierra Leone.